Okay guys, my presentation is on pulmonary atresia. What is pulmonary atresia? It is a congenital heart defect present at birth and/or diagnosed soon after. The valves that let the blood out of the heart to go to the baby's lungs the way it should form a tissue. Blood can then not travel its normal route for O2, thus having to take other passages in the arteries within the heart. This is a picture showing you what pulmonary atresia is. There are two types: pulmonary atresia with an intact ventricular septum. Very little blood flows in and out of the right ventricle, with the septum/wall remaining complete and intact. The right ventricle doesn't fully develop and remains small. Pulmonary atresia with ventricle septal defect. The right ventricle has blood flow, therefore develops, but very similar to another condition called tetralogy of Fallot, but very severe. There are many things used for diagnosis. An X-ray, it's used to see the extent of it. An electrocardiogram, used to detect the abnormal rhythms and might show the muscle of the heart stress. An echocardiogram, usually used to diagnose and often through the woman's abdomen prior to delivery, also known as the fetal echocardiogram. And cardiac catherization, it shows a detailed structure, blood pressure, oxygen level, pulmonary artery, and the aorta. Signs and symptoms. If a baby is born with pulmonary atresia, they may have bluish or gray to their skin tone, shortness of breath, feeding issues. The feeding issues can be due to shortness of breath, or they can also have easily tiring, which can also cause the feeding issues. Who is at risk? Babies are at risk. There is about 1 in every 7,100 born that have it. 550 babies in the U.S. a year are born with it. But I also did find out that my stepmom also has it, and she didn't find out till later in life. Risk factors include genetics, a parent who has a congenital heart defect, an obese mother, smoking before or during pregnancy, diabetes poorly controlled, and some medications such as blood pressure and acne medications can also cause a risk. Medical or surgical treatment. Basically, it all depends on the severity of the child's condition. One of the procedures they use is by catheterization. Balloon arterial septostomy is used to enlarge the foramen ovale, allowing blood to travel to the lungs. Stent placement. The stent is placed between the aorta and the pulmonary artery to keep it open and to allow blood to travel to the lungs. Heart surgery. Shunting they usually use, but it is usually outgrown within a few months. But it creates a way from the main blood vessel to the pulmonary arteries to allow enough blood flow to the lungs. The Glenn procedure connects to a large vein that returns blood to the heart to the pulmonary artery instead. Fontan procedure is used if the right ventricle is small. They use this to create a pathway that allows most, if not all, of the blood to flow directly into the pulmonary artery instead of coming to the heart. Or, last case scenario, a heart transplant. Sometimes the heart is just too damaged for repair. This is a picture that shows what a normal heart looks like and one with pulmonary atresia. Prognosis. Usually they're in the ICU after surgery with a ventilator and a heart monitor. Feedings after surgery may be difficult due to the infant being too weak. Regular follow-up appointments with a cardiologist. Possible additional heart catheterizations or procedures as the child grows. Possible long-term complications such as heart failure, narrowing of the pulmonary artery, and abnormal heart rhythms can be taken care of with regular follow-ups. Nursing diagnosis with nursing interventions. I picked impaired gas exchange related to ventilation perfusion imbalance, as evidenced by cyanosis, shortness of breath, feeding issues, and easily fatigued. The interventions I decided for this would be an EKG and a chest x-ray to give us a baseline, assess vital signs every 4 hours, continuous SpO2 monitoring, apply supplemental oxygen to maintain SpO2 at 95 or higher, assess skin for cyanosis routinely, assist mother and baby at feeding times, and consultation with a congenital defect pulmonologist. And that is a list of my websites that I use to find my information.